Hi again, doing another video. Got my lad with me helping me out, doing it at home again because it's easier for me to do some at home and I've been busy at work again. So just want to show, I talked about maybe doing rubber dam. I went through a previous video about what you use for root canal treatments. A few things. This is the rubber dam sheet and it's latex free. It has to go over the mouth. So it goes like that over the mouth. And you need to have the part exposed. So do root canal treatment, say in the on my patient yesterday, I did root canal treatment on the first big molar here, this one here. So we're going to demonstrate on this. So we need to cover it, but leave this bit exposed. So what you're going to do is get this pack here, this all packed up and sterilised, and then sterilise it again. So I'll sort that out in the morning. What we do is this hole punch makes a hole. Yeah, certain sizes, so we're going to go for a fairly big one, and it's going to go about down here, so you've got an idea where it needs to be. Put the hole in here. This for people who want to know how to use rubber dam as well, so I'm not saying it's perfect, but works for me. And then what you can do, there's a couple of ways of doing it. If you use this, there's certain things called wedget, which are little rubbery tube. You'd get someone to hold it on there. Sorry, I'm not doing very good. You'd stretch it over the tooth and get someone to hold it in place, and then you floss down these rubbery thick little tubes and it holds it in place. I haven't got it with me, but that's one way of doing it. Second way is to literally sit like that, so you've got all the mouth covered up, all the teeth, and then you do it like that. You use this frame then to have it like this on the lower lip, yeah, and this on either side of the nose, and you put something cotton balls against, so you're trying to stretch it out, so it holds it stretched out like that. I can't demonstrate properly, because anybody can demonstrate properly on a patient. So you stretch it out and out to hold it in a frame, and it made it all torn. So that's one way of doing it. So that holds it inside, then you drill it and clean out, do all your stuff. The other way is to use a molar clamp. So this for molar teeth, quite big, get different sizes. These are rubber dam clamps. So what you do, if you push that over literally to hold it in place, you literally hold it in this thing, stretch it out, and then you go over there. You're going to make sure the patient's numbed up first, and that's it, literally there. Don't be stretching over that. And literally that holds it in place, locks it in place, gives you a bit of space, and then you drill, do your root canal treatment, all the filing and everything out, like we showed you before what we use. But you know, I may get a tooth in a bit of a block and show you that root canal treatment in one video as well. The other way, so obviously it would normally pop off a normal tooth, could be quite slippery, so you can't put it on like that without someone helping you. So what you can do another way is, if I take that off again, there's two ways of doing it. Firstly, this way, where you'll get this, put the wings, these are little wings, these bits here, put one in here, put one across like that, stretch it over, and then you get this, put it over the tooth, like that, clamp it. Remember, you're going to have them numbed up, okay? So, numbed up, take it off, try and get it off. So you get it off, and then you're going to flick this bit. You normally get like a little tool, flick it over, because you don't want anything. You want it all sealed. So you use a little tool and pull it over, and then that's all sealed. And then when you're doing your root canal treatment, anything you'd use like the file or medicaments, like you use Milton's, which is a mild bleach, perfect concentration, and things like EDTA. You're going to clean it out. It stops the bacteria getting in there while you're doing it, and stops any of these solutions getting out. You will use high volume suction the nurse uses here to make sure you suck everything out. You don't want any getting leaking underneath, so you use suction to suck it out. But this protects the mouth and protects the tooth from the bacteria in the mouth. And when using files, if you drop a file down, it goes down a throat, you're in big trouble. You don't want to drop a file off. So when using little files, cleaning it out, it gives you a nice feel to work with. You can also use this for doing white fillings, if you're doing composite fillings, but you'd need to do maybe a different system if you're going in the front or the back of the tooth, because you need to get a ring around the tooth for a white filling. White fillings are feeling perfectly dry, but if you use a white filling cotton wool rather than either side, and you can keep it dry and guarantee you keep it dry, it'll be fine. This if you really want to have an easy life and you're really keen on using rubber dam. A lot of people don't, you look like rubber dam covers the mouth. The next option you've got is this one here, which is one I tend to use because I find it easier. Put the clamp on first, like so. And this is going to look a bit mad. It worked for the lady. You literally get this, open it up hugely, and then you pull it, literally yeah, it does do that sometimes. It does do that sometimes. I'll show you again. So see, it does it all right. That's what I mean, it doesn't always work. So Not a great demonstration, but it does work. It did work on my patient yesterday. And the root canal treatment went very well, by the way. I just say, root canal treatments are really difficult. We don't, unless you're a root canal treatment specialist. So there, you go over, you don't stretch it so hard so it breaks. You go over like that, and then you just flick it over there, and literally flick it over there, and you get the same result. Yeah, so whatever works for you. And then you've got to put the frame on here, stretch it out here. You're going to collect it like that and like that, and that's obviously where it's broken, so it wouldn't be like that. Flick it over there. It keeps it nice and taut, and you make sure it's bent over so it doesn't go over the patient's nose. So it'll be literally like that. I know it's a bit crude, but that's how it works. Obviously you wouldn't have that bit broken. I would have done it with another fresh piece, but of rubber dam, but I'm not going to waste it. Waste my boss's money. So just there, literally like that, and it'd be sitting on top, and that'd be all covered. It's a bit hard to show because you're not doing it in the mouth, so kind of like that. Need another set of hands. So literally then the patient's mouth top would be like that a bit. So now you've got all the room to work with. It's clear, filled, and you're not going to cause any liquids going to the patient's mouth. The file's not to drop. You're not worried about anything bouncing off the patient's tonsils. It'll be bouncing off the rubber dam and falling out the mouth. So you always have high volume suction, and nurse always doing suction whenever you're filing or anything, just in case, especially when you're irrigating or using a syringe to flush out the channels. And then these, it's got 2 roots at the front, 1 root at the back, so 2 canals. We did 2 at the front, 1 at the back. Back one's easier to get to because it's a bigger, wider channel or canal, and the 2 fronts a bit more fine, they curve forward. So it's like that. It's literally like that shape. So they curved at the front, back one's really big and nice. These 2 are a bit thinner, so you have to work them a bit more, and they tend to be curved at the tip, make it a bit difficult, so you file them out, and that takes a long time to do properly and well. If it goes all to corner pan, fairly quickish, but you're looking at least an hour to do. You can do it in a separate stage, but if the patient's okay to do it in one stage, it's always better to complete a root canal treatment in one visit, because the bacteria can cause infection and cause problems, and generally the success of root canal treatment is better in one visit. You're looking at minimum an hour, about half an hour per canal, minimum an hour if it goes perfect. Commonly they don't, so it takes longer than that. When we did the filling for the root canal treatment for the lady, we didn't do the final filling or final complete treatment on top. We put temporary in, and then when she comes back in, we're going to complete the treatment, whatever we decide to do to complete it. So you have to get a good seal on top. So that's it. I just want to show you rubber dam. Obviously that wouldn't have happened. If that happened, we would have discarded it. So imagine that being fine. That's how it is. Okay, so there's 3 methods. Wedgets, which are like, it's the name of the company, but they're kind of rubbery elastic bands, but the cylindrical, and you just floss them in between, and it holds it in place there, They can be a bit fiddly to get down, so you kind of floss in them trying to get them in. There's different sizes, for tighter gaps smaller, for large gaps wider. This works quite good, and then as long as the patient's numbed up, you don't feel it too much. You can feel a bit uncomfortable, but not too bad. And then you've got the option where you actually have the rubber dam attached to this, and then you put it in, and then the last one I showed you when you put the rubber dam first, and then pull it over, provided you don't split it like I just did. So that's just the way to do it. I mean, it's how we do, that's how every root canal treatment should be done, with a rubber dam and using these tools for clamps, or the other methods. There'll be other methods as well, and some of the clamps you can get are just a bit more sophisticated, more fancy, but that's ones where you have always used. NHS root canal treatment works pretty good. Privately, maybe they do it slightly differently, but that works for me. The root canal treatment was fairly successful, went well. I showed a few colleague of mine who's really into root canal treatment. He liked to look at it, so it went really well from what you see. But rubber dam is important for the successful root canal treatment and for protecting the patient. The first thing, you protect the patient. Second thing, you want a successful root canal treatment. Well, together it's kind of same. You want them to be good. So that's the system you use. I thought I'd show you that because I did explain in the previous video that we'll do maybe a video to show you how rubber dam works. So that's the video. If you've got any questions, queries, let us know. I may do a question and answer session depending on anyone's interested. But anyway, we'll see. Okay, so that's the video. Thanks a lot. Take care. See you next time. Bye-bye.